Hi everybody, I'm Dr. Jon LaPook. Welcome to CBSDoc.com. I'm here in beautiful Central Park in New York City. It's a lovely summer day, and I'm going to be talking to people about when should you fire your doctor, and how do you know when it's time, and how do you do it? I'll also be talking to an expert about this at Mount Sinai School of Medicine. So let's grab some people as they're walking by, some genuine, real patients. What's the longest you've ever waited in a doctor's office?
I waited 5 hours, all these sick people around me, and the next day I was sick.
Your time is valuable too, right?
Yeah.
You got some serious things to do, right? Like what?
Watching TV.
Okay. Do you find you have to wait a long time when you're in the doctor's office? Yeah, you find that. Do you find that you don't have to wait a long time? Yeah, you find that too.
I run track and field, and I felt like I was fine, felt like my hamstrings was fine, but he wanted to sit me out at like 90 days.
And did you fire him?
I did. I've totally fired him. Went to a trainer, a personal trainer who told me there was nothing wrong, who referred me to a nutritionist and countless other sport medicine doctors, and I was fine, and I wound up winning NCAAs that year. So,
Whoa, what year was that?
that was actually this year.
Let me ask you a question. Have you ever wanted to fire your doctor?
Sometimes.
Yeah. What, because they're telling you like you got to walk on your feet rather than your hands?
Yeah, all the time.
What's been your experience with doctors? Have you ever had a time when you were just ticked off?
I've had many times when I've been ticked off by a doctor. Won't give me the time of day to answer questions, rushes me out of his office.
We have a program that uses actors who portray patients in a standardized way to help health professionals learn how to interact better with patients.
What are some of the most common complaints patients have?
That it's hard to get an appointment with their doctor.
All right, what do they do about that?
One, you shouldn't wait until you're very, very ill. You should have a much lower threshold for calling to find out whether this is a real problem or not. You need to say to the staff, I have these complaints. It's not a quick focus visit. I think I may need a little extra time. They can book a double appointment for you. If you think it's urgent, you may want to say, I'm really worried. I'm in a lot of pain. I would like to be seen soon.
What's another problem patients have?
That they're waiting forever to see their doctor.
What is the excuse for that?
There are two major reasons I think why that happens. The first reason is that somebody comes in with a complaint and it's much more complex than you think. The second thing is patients come late. I think you need to address that with the staff, and there are ways around that. You take the first appointment in the morning.
Yeah.
You make sure that, the first appointment in the afternoon. That's right, if it's that important to you. But you also need a window of time, so if you know you're going to go to the doctor for an hour, you probably ought to book two.
When is it time to fire your doctor?
In a long-term relationship with the physician, I think that that relationship develops over time, and your expectations are very different than if you go to somebody once a year or once perhaps for a surgical consultation. If this person is going to be with me and needs to understand me lifelong and help me improve my health care, then I want someone that I can relate to, that I can trust, and that I feel like is on my side. On the other hand, if I have to have a surgical procedure, I want the best technician. And it doesn't matter so much if their bedside manner isn't perfect. If they're technically skilled and I'm going to see them once before in the office for a visit, they do the surgery, and then once for follow-up, it's not that important that I really respect that person and feel respected by them.
All right, so push comes to shove and you've decided I really don't think this is working. You call up the office and you say, what, transfer my records?
That's right. I'm discontinuing my care with this physician. I've chosen another physician. I'd like to have you copy my records and send them. You need to sign a release. Usually they won't accept that over the phone. There's a paper release that you can get, and they may fax to you, and you can fax back saying, I give you permission to send my records to Dr. So-and-so. And then they send the records. In an ideal world, you would give feedback to that physician. And in an ideal world, they would care and try to think about changing their practice for the other patients that are there, or in fact, apologizing and seeing whether you can make another go of it.
I think that's a very good way to end this, that the responsibility is not just with the physician, and it certainly is there, and it's not just with the secretary and office manager, it certainly is there, but it's with the patient too. The patient has a responsibility to make their demands, to make their desires known.
And their feelings, that's right.
And when something's going south or it's not happening the right way, you got to say something. Never silently seethe. I want to thank Dr. Erica Friedman from Mount Sinai School of Medicine for all of your expertise and for listening to me. Thanks, Doc.
You're welcome.